Chapter 2, Homeostasis and Adaptive Responses to Stressors. In this chapter, we'll talk about homeostasis and allostasis. We'll discuss stressors, risk factors, and the general adaptation response, or our body's response to stress. Then we'll discuss different types of stress and treatments. So homeostasis is your body's ideal set point. So this is when different parameters like osmolarity, temperature, pH, gases, ions, hormones are at its ideal set point. Now, when your parameters are where they are supposed to be when your body's working normally, then everything is fine, your body functions appropriately. But these parameters can change, and that's okay. When it does change, we have a homeostatic response that kicks in to try to reestablish homeostasis. It's a mechanistic, very predictable response. For instance, if your blood pressure starts to go up, our body will stimulate the parasympathetic nervous system to try to lower blood pressure back to normal. So it's predictable. We know exactly how the body's going to respond. And when homeostasis is reestablished, then your body is fine, you are healthy, everything's normal. It's when it's unable to be reestablished that disease and illness kicks in. Allostasis is your ability to successfully adapt to challenges, and it essentially means you're taking the environment into consideration. So, for example, if you are exercising and your heart rate is elevated, it's okay that it's elevated because the environment is exercise and you need your heart to pump with greater force and move more blood throughout your body. And we don't want to bring your heart rate back down in light of the environment that is happening right now. So let's quickly review homeostasis. When David runs a mile, his muscles release heat, which causes his body temperature to increase. In efforts to return his temperature back to normal, his sweat glands are likely to. So he's hot, we want to lower body temperature, so his sweat glands will increase secretions. Blood vessels of his skin, his cutaneous blood vessels, are likely to then dilate. And these mechanisms are examples of what kind of feedback? It would be negative feedback because they alter parameters like temperature in the opposite direction as it had originally been changed. Now, most control systems in the body are negative. They are negative because what they do, negative feedback does, is that it introduces stability into a system. For example, the release of the pancreatic hormone insulin in response to elevated blood glucose levels. What does insulin do? It will lower blood glucose. So the opposite direction to bring stability. Now, stressors are something I'm sure we are all familiar with. They're basically agents or conditions that endanger homeostasis. Stressors can be anything from something physical, chemical, emotional, social, cultural, biological, and it can vary in scope, intensity, and duration. Now, when an external stressor disrupts homeostasis, again, that's when illness may occur. Again, we do have feedback control systems that try to restore homeostasis. Now, all of us experience stress every day. And in small doses, stress is actually beneficial because it can increase energy. It can keep us alert, keep us focused on the problem at hand. When stress becomes too great, though, that's when it becomes a problem. It can damage your health, your mood, your productivity, your relationships, and overall quality of life. And reactions to stress. How you respond to stress can also vary based on your genes, your gender, past experiences, cultural influences, your developmental stage, your age. So not everyone responds to the same stress the same way. Now remember, risk factors, they are not stressors, but they are conditions or situations that will increase the likelihood of encountering a stressor. Now, I want to point to this little figure I have up here. And what this shows is in the x-axis, you have your stress level. In the y-axis, you have things like performance, happiness, and health. And again, what I want you to notice is when there's moderate levels of stress, this is when you are most productive. You are happiest and healthiest. So again, in small doses, it can be beneficial. When stress is too high, that's when you become too anxious, your performance suffers, your health suffers. But look at the other side. When stress is too low, also that is not good for you. So think about how when you have absolutely no stress, don't you find that during those times you are the least productive? Now, how does our body respond to stress? Well, we have our general adaptation response. So when the stressor occurs, whether it's physical or psychological, our body will sound the alarm. So that's the first step. We have our alarm reaction. So this is when you're going to arouse the central nervous system, specifically the sympathetic nervous system, which we know is our fight or flight. So hormones like epinephrine, norepinephrine, other hormones are going to get released. They're going to increase our heart rate, increase contractility of the heart, increase our respiratory rate, increase mental activity. Notice we're basically sounding the alarm, getting our body going to be able to deal with the stress. Then the second stage is resistance. So this is when the activity of the nervous system and the endocrine system is reestablishing homeostasis, or working to do that, attempting to do that. If we are able to successfully reestablish homeostasis, then we have recovered, we're on the last stage, and everything's back to normal. If we are not able to, then we have the stage of exhaustion. So this is the point where the body can no longer return to homeostasis, and we have this allostatic overload. And this is when organ damage and disease can start to set in. Now, we talked about some of the other responses, other hormones that can be released in response to stress. They include our hormone CRH. CRH stands for corticotropin releasing hormone, and it's going to eventually cause the release of cortisol, your stress hormone. We also have your antidiuretic hormone, also known as vasopressin. Again, the sympathetic hormones like epinephrine, and then the neurotransmitter norepinephrine, and then the RAA. So the RAA, if you recall, is the renin-angiotensin-aldosterone system. This is going to do things like increase blood pressure, increase blood volume. And this is just a figure that shows you some of the hormones that are released, or how they are released. So if you recall, the hypothalamus, the pituitary, the adrenals, we have this axis in which hormones are released. So this is just a review slide for you to peruse. Okay, so stressors. Well, they can change the internal environment of the body. So keep in mind, the stressor itself will exhibit signs and symptoms. But when we have a stressor, when we encounter a stressor, our body will try to adapt to that stressor. It'll respond to the stressor by turning on what we just talked about, the general adaptation response. And that general adaptation response tries to respond to the stressor and reestablish homeostasis. As a result, we will also see the signs and symptoms of that GAS, the general adaptation response. Now, just a quick reminder, signs would be the objective things that we see. Symptoms would be the subjective. So if you see bleeding, if we're talking about lab results, those are all signs. If someone says that they have headaches or they have back pain, those would all be symptoms. So why is it important to know the GAS? Well, the reason it's important to know the GAS, the General Adaptation Syndrome, or the General Adaptation Response, is when you see a client, they're not only going to exhibit the signs and symptoms of the underlying disease, but they're also going to exhibit the signs and symptoms of the GAS. Remember, our body is trying to respond to the stress by turning on the GAS, so you're going to see the effects of that on the body. Therefore, you need to know those signs and symptoms, because if you try to suppress the GAS, you may actually make your client worse by interfering with the natural coping mechanism. Sorry, that was kind of off. All right, so back to that cortisol hormone. So just a review, a reminder, this is your stress hormone. So the hypothalamus in times of stress, with the help of the sympathetic, will release CRH, corticotropin releasing hormone. CRH will stimulate the anterior pituitary to release ACTH, adrenocorticotropic hormone. ACTH will stimulate your adrenal cortex to release cortisol, your stress hormone. And cortisol is going to increase blood glucose, suppress the immune system. And this is what will get your body kind of going to be able to respond to the stress. Antidiuretic hormone, also known as vasopressin, it causes vasoconstriction, and in the kidneys, it causes reabsorption of water, so less urine is produced. And for the sympathetic response, we know that the hypothalamus can activate sympathetic neurons and cause the release of norepinephrine as well as epinephrine through the adrenal medulla, the hormone. And the effect of the sympathetic on the heart is an increase in heart rate, increase in contractility. So your heart's going to beat faster and stronger. your blood vessels will vasoconstrict in the skin, the gut, and the kidneys, and all of that is going to cause a rise in blood pressure. The RAA, the renin-angiotensin-aldosterone. So it can be activated by the sympathetic. It's also activated by low blood flow to the kidneys, but it all starts with the release of renin from the kidneys. Renin will convert angiotensinogen, released by the liver, into angiotensin 1. Angiotensin 1 gets converted into angiotensin 2 with the help of ACE, angiotensin converting enzyme. Ang2 will go to the adrenal. It'll do many things, one of which is it goes to the adrenal cortex and causes the release of aldosterone. Aldosterone will then cause the kidneys to reabsorb water, and it will do that by causing you to reabsorb sodium, and water follows sodium. It will also cause you to secrete potassium, and the way the kidneys does that is by turning on the sodium-potassium pump. And if you recall, the sodium-potassium pump pumps 3 sodium out of a cell, 2 potassium into a cell, and by moving sodium, water will follow. So you can reabsorb the sodium. As a result, or as a consequence, you'll secrete potassium. And by keeping more sodium and more water, you will increase blood volume and increase blood pressure. So this is all a review of what happens in normal. All we're seeing is that it gets turned on in response to stress. We also have endorphins that are released in the GAS. So endorphins are endogenous opiates. So these are actually your body's natural pain relievers. So they raise the pain threshold so you don't feel pain as quickly. And they can also produce a sensation of sedation and euphoria. Oxytocin is also released. Now this is typically produced during childbirth as well as during lactation, breastfeeding. It's also associated with bonding and social attachment. And it's thought to moderate the stress response and produce a calming effect. So let's review stress. We are going to arrange the stress response in the correct order. So the first response would be you're going to sound the alarm, then you will resist, and then hopefully exhaustion doesn't happen, but it may. Which phase involves action of pituitary, sympathetic nerves, and adrenal medulla and cortex hormones? That would be the alarm stage. And in which phase does the body try to fight back? That would be resistance. And if that fails, then the stage of exhaustion with possible death can occur. Which stage of the general adaptation syndrome facilitates the individual's allostatic restoration of homeostasis? That would be resistance. So we're trying to resist. All right, so here's the scenario. A woman is brought into the hospital after a motorcycle accident, and she presents with the following. She has increased heart rate, no urine is being produced, no bowel sounds are being detected. She's pale, she has sweaty skin, low blood pressure, dilated pupils, and elevated blood glucose. Looking at her signs and symptoms, what should be fixed first and why? Well, if you take a look at her signs and symptoms, a lot of them are related to the GAS. So remember, the GAS is the sympathetic. So think about what happens when the sympathetic is turned on. You're going to have high heart rate. You're going to vasoconstrict blood vessels, so no urine is produced, no bowel sounds. You'll have pale, sweaty skin, low blood pressure. Well, let's think about that a little bit before we move on, or we'll get back to that. Dilated pupils, elevated blood glucose, all of these other guys are related to the GAS, but that low blood pressure is not. So the symptom that you want to address first is that low blood pressure. So think about if the GAS increases heart rate and it vasoconstricts, and we know you're vasoconstricting because there's no urine produced, there's no bowel sounds, you have pale skin. Both high heart rate and vasoconstriction should raise your blood pressure, or at least keep it normal. But the fact that your blood pressure is low indicates that this is a problem. So this is what you want to address first. Now, this is why it's important to understand the signs and symptoms of the GAS, because if you didn't recognize that these other symptoms were related to the GAS and you try to address that first, then let's see what would happen. Let's say, okay, you saw that heart rate was elevated, so we want to reduce our heart rate. What is that going to do to our blood pressure? It's actually going to drop it even lower, and that might put the person into shock. All right, so a little bit more review of the brain. Which area of the brain conveys sensory information about stressors to different parts of the brain. That would be your thalamus. So the thalamus is where most of your cortical spinal tracts will run, and it will then relay it to the correct part of the brain. Which part of the brain facilitates mental alertness during stress? That would be your RAS, your reticular activating system. This is going to alert you, arouse you. Which part of the brain is involved primarily with the emotional aspects of stress? Emotion is the limbic. And then finally, which one coordinates autonomic and endocrine response to stress? That would be the hypothalamus. Okay, stress can also affect the immune system. And what stress does is it actually suppresses the immune system. It decreases immune cell production. So essentially, when you're stressed, you're going to divert energy away from things that are what they think is non-essential, or what our body says is non-essential. And right now, when you are trying to run away from that tiger that's chasing you, making new blood cells may not be the most important thing to do. And since your white blood cells are made in the bone marrow, you're going to decrease the production of those white blood cells. There's also been evidence of decreased thymus activity. And if you recall, the thymus gland is where your T cells mature. So overall stress and cortisol suppresses the immune system. So this cartoon here, you can see this man came into the doctor because he was sick, and the doctor advises, you've become run down from working too much, try sneezing on your boss. So basically he's saying your immune system is suppressed because you are stressed. Now let's talk about different types of stress that you can experience. So the first type is physiologic stress. So something physical. So this is stress-induced changes in body function. It's detected by your body's normal regulatory sensors, and the body will alter function to try to restore balance. And once balance is restored, the negative feedback will stop the reaction and you're back to normal. So this is the normal kind of physiologic stressors that you may experience. Another type of stress is psychosocial stress. So psychosocial stress is something related to social or psychological stressors in origin. So examples include things like maybe experiencing natural disasters, loss of a job, war. It could also be things like position in a social hierarchy, feelings of isolation, or discrimination. It will directly affect the CNS. So even though your body, there's nothing physical that's happening to you, your body will still respond. So the central nervous system will get affected, and your body will respond the same way it knows how to respond to stress, which is to turn on the GAS. So even though the body's internal sensors have not detected anything as being out of balance, it will still respond by turning on the GAS. Now, does the stress response solve the person's problem? No, it does not, but that's how our body knows how to respond to stress. Then we have acute stress. So acute is sudden onset, short duration. So the acute stress response includes pounding headache, cold, moist skin, stiff neck. You'll activate neural pathways that mediate things like arousal, alertness, focused attention, and even aggression. And for people who have limited coping abilities, even acute stress can be detrimental. And in some situations, it can be life-threatening. So think of someone walking across the street, a speeding car is coming at them, and then they kind of freeze. And so obviously that would be catastrophic. So which organs of the body would you expect to see damaged by acute stress, and why? Well, think about the stress response, the GAS. And with some of the things that the GAS does is it vasoconstricts blood to the skin, the GI tract, the kidneys. So that sustained vasoconstriction causes ischemia, interruption in blood flow to these areas. So you can expect these areas might become damaged if it's constantly getting a low blood supply. The other thing that happens with the GAS is we're really activating our heart. We're causing our heart to beat quicker and to beat stronger. And the oxygen demand may not be met by the oxygen supply. So by overworking that heart, that can be another organ that's adversely affected. Another type of stress is chronic stress. So chronic stress is longer duration. So sympathetic nervous system will be activated. Cortisol is elevated. Again, this is our stress response to GAS. Complications can also result from reduced immune response. So basically, your body's defenses are lower, so you're more likely to get ill. Now, long-term exposure to stress can lead to really serious health problems because it can disrupt nearly every part of your body. So it'll raise your blood pressure, suppress your immune system so you get sick more, increase your risk of heart attack and stroke, contribute to infertility. It can even speed up the aging process. It can also rewire the brain, causing you to become more vulnerable to anxiety and depression. So stress is one of the worst things that you can experience. So being able to cope with stress in a positive way or an effective way is quite important. Now, one example of chronic stress is PTSD, post-traumatic stress disorder. So PTSD is kind of unique because it is a type of chronic stress. And just like chronic stress that we just mentioned, the sympathetic nervous system is activated. But cortisol levels, which we said earlier in chronic stress is elevated, in PTSD it's actually not elevated. Now here I've written that it's decreased. So you can think of it as decreased compared to what we normally think of as chronic stress elevation, or just think of it as it's not elevated. Now, if you do further research, there's different studies out there showing PTSD may have elevated cortisol, may have lower cortisol, etc. But for our purposes, we're going to stick with cortisol levels are not elevated. It's decreased from chronic stress levels. Now, people can suffer from PTSD due to experiencing potentially life-threatening events like war, hurricanes, tsunamis, child abuse. I had a student share that they suffered from PTSD due to a car accident. Now, less than half the people who experience those events actually experience PTSD. So if you do experience it, what are some of the symptoms? So there are three main symptoms. One is intrusion. So in intrusion, you keep feeling intruded upon. So you keep re-experiencing the event through flashbacks. Then there's avoidance. So basically you try to avoid things, people, relationships. So it's an example of emotional numbing. It will disrupt relationships. It can cause you to go into depression. And then hyperarousal, exactly what the name says. You are overly sensitive. Your arousal is increased. So you have increased irritability, difficulty concentrating, exaggerated startle reflex, increased vigilance over your safety. It can also be, PTSD can also be associated with things like memory problems, sleep disturbances, and obviously excessive anxiety. So a little bit more of a review on stress. Jamal is 5 years old and he has had middle ear infections 4 times in the past 2 years. So would you categorize him as having acute stress, chronic sustained, or chronic intermittent? So chronic sustained would be constant, intermittent is coming and going. So he is 5, he's had 4 infections in the past 2 years. So it is chronic intermittent. It's lasted 2 years, but it's only been 4 times within those 2 years. Joe, age 40, was diagnosed with ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease, which is a progressive neurodegeneration of the motor neuron. He was diagnosed at age 37. He still speaks and swallows, but most of his body is paralyzed. So that would be an example of chronic sustained. So it's never gone away in those 3 years. Stephanie develops a respiratory infection that leads to pneumonia within the first few days after she begins attending daycare during a viral epidemic. So that would be acute. Okay, so we talked about how our body responds to stress. We talked about the different types of stress. Now let's talk about adaptation to stress, and then we'll discuss treatment. So how we adapt to stress is determined by several things. Remember, we can experience the same stress, but all of us will respond to that stress differently. So one thing that makes it different from individual would be our physiologic reserve. So physiologic reserve is the ability of our body systems to increase their function given the need to adapt. So for example, let's use heart rate. So resting heart rate is about, let's say, 70. Maximum heart rate is about 220 minus your age. So let's say you're 20, so your maximum heart rate is now 200. So that means our physiologic reserve for our heart rate is 130 beats. So resting is 70, our max is 200, so we can technically do an extra 130 beats per minute. Now, if that's a normal person, let's talk about someone who is extremely unhealthy. So they live a sedentary lifestyle, they are overweight, they're just not very healthy. They tend to have a higher resting heart rate. So let's say their resting heart rate is 100. They can still max out at 200 technically, but now their physiologic reserve is only 100 beats per minute. They can only do an extra 100 beats. So when they encounter stress, these two individuals, the person who can raise their heart rate an extra 130 beats is going to adapt better than someone who can only raise their heart rate an extra 100 beats. So that physiologic reserve, the bigger the physiologic reserve, the better you're going to adapt to stress. Time is another determining factor. By time, we're talking about the fact that adaptation is more efficient when the changes happen gradually. For example, if you lose a liter of blood through chronic GI bleeding over the course of a week, the effect is going to be more mild compared to losing a liter of blood in the matter of seconds because of a sudden hemorrhage. Then we have our health status. So how healthy are you? Physically and mentally healthy. Those physiologic and psychologic reserves are going to determine how well you're going to adapt to stress. So if you're already sick, you're not going to adapt to stress as well as someone who's healthy. And then we have age. Your capacity to adapt decreases with extremes of age. So infants and the elderly are not going to adapt as well as those who are in the prime of their age. Others include genetic endowment. So your genes play a role. So for example, in Africa, the gene for sickle cell anemia still persists because it provides resistance to infection from the malaria parasite. So that's a genetic endowment. Hardiness is another factor. That's your individual's emotional reactions to stressful situations and their coping mechanisms. So some people kind of stress out really easily with any kind of change versus others it doesn't really affect them very much, and they have really good coping mechanisms. Then we have psychosocial factors. So do you have a lot of support? The more social support you have around you, the better you're able to withstand stress. That's why there's a lot of support groups that are so important out there. And then we have nutrition. Well, nutrition is important because our body makes its proteins, its enzymes, its hormones, and all of these things with the foods that you bring in. So having a deficiency in anything can make you vulnerable, or having too much of bad types of things that you're bringing into your body can also make you vulnerable. For example, obesity. That's going to predispose you to things like atherosclerosis, hypertension. You're not going to adapt to stress as well. And then finally, we have our sleep-wake cycle. Sleep restores function, tissue regeneration. We want to sleep to be healthy. So it's really important that you have a normal sleep-wake cycle. For example, even hormones are released in a circadian rhythm. And so we really want to maintain that rhythm and not disrupt it. And again, anything that kind of disrupts sleep, you already know is pretty stressful to your body as well. All right, so a review of our adaptation to stress. You're going to identify who adapts best to stress and why. So losing 25% of your total blood volume in Jeanette by arterial hemorrhage within a period of 3 minutes versus Irma by bleeding from a peptic ulcer over the course of 3 months. Who would adapt better? It would be Irma because of timing of onset. It's happening slowly over 3 months. And by happening slowly over 3 months, our body is able to adapt to it better than if it happened all at once. What about someone who has prolonged diarrhea? In Jamie, who's 2 months old, or Cassandra, who's 20 years old? Who would adapt better? Cassandra, because she's 20 years old. Okay, Jamie's only 2 months, so she's at the infant stage. She's at one extreme of age. All right, we're going to end with how we treat stress disorders. And one of the most important things is avoid coping behaviors that impose a health risk. Examples include smoking, drinking, excessive eating. So anything that's kind of not going to be a good way to deal with stress, you don't want to go that route. Instead, you want to provide alternative strategies to try to get your brain to kind of turn off that sympathetic activity that's kind of constantly going to get your body active and going. You want to be able to relax. And here are some methods. The first is the relaxation response. And it's basically where you can sit quietly in a comfortable position, deeply relax your muscles, breathe with awareness, maintain a positive attitude. It sounds a lot like yoga or meditation. And so this is going to kind of help you to relax and calm down. And if you've ever practice meditation, practice yoga, you know how relaxing it can be. And so when you're really stressed, this is what a lot of people turn to help them deal with it. And it's very good for you. Okay, then we have imagery. This is where you're going to try to involve all of your senses to try to relax. So, imagine you're lying on a beach and listen to the sound of the waves, etc. And then speaking of listening, we have music therapy. So a lot of people identify with listening to music to help them deal with stress. So it can help reduce that feeling of stress. Then we have massage therapy. So I particularly like massage therapy because it's very relaxing. So it helps relieve muscle tension. It just feels really a de-stress kind of thing to go through. And then finally, we have biofeedback. So biofeedback is where you learn to control your physiologic function by monitoring response to stress with immediate feedback. For example, you can measure muscle tension with an EMG. You can look at your body's heat level, sweat. You can look at your ECG. And I'll give you an example of biofeedback here. So we have Mr. Smith had some hard times in the Army. He says he dealt with it, and he has become a successful air traffic controller. And if you don't know air traffic controller, that's one of the most stressful jobs out there. Mr. Smith is 50 years old. He's overweight. He has increased blood pressure. He has occasional tachycardia, so a high heart rate. He has insomnia. He can't sleep. He has GI discomfort. He's also had several colds already this year, so he wants a flu shot. What about his case might be stress-related? Well, it kind of sounds like most of his conditions are stress-related. He has stress, we know, increases cortisol, which suppresses the immune system, and that might be why he's constantly getting sick. Our body's response to stress also means we're going to turn on the sympathetic, which is probably why he has high heart rate, high blood pressure, GI issues. Now, my next question is he suffering from PTSD? Remember, he was in the Army, so that might kind of make you think he might be, and it's quite possible. But remember, with PTSD, we said cortisol is not elevated. Sympathetic is turned on, but cortisol is not elevated, at least for our purpose. And cortisol is what we're saying is suppressing his immune system, leading to his frequent infections. So is he suffering from PTSD? He is not. Because here, in this instance, we know his cortisol is elevated because he's constantly getting sick. So I want to make sure I said that correctly, okay? So he is not suffering from PTSD because in PTSD, cortisol is not elevated. But his signs and symptoms indicate cortisol is elevated because he's constantly getting sick, probably because his immune system is suppressed. Okay, so he is not suffering from PTSD. Okay, so then his doctor said, let's try to deal with it another way. I have a recommendation. I want you to do relaxation therapy. I want you to go and meditate, do yoga. And he says, no way, okay? I'm not going to do this stuff. This isn't my thing. So how will you explain the physiological basis of doing relaxation therapy to him? And essentially, it's the fact that by doing relaxation therapy, you are trying to control the hypothalamus to stop stimulating the sympathetic nervous system, thus reducing epinephrine, reducing cortisol, and then all of his signs and symptoms should really go away. Now, he still doesn't really buy it, and so then you would suggest that he try biofeedback. So what you're going to do is you're going to ask him to do the relaxation therapy. Okay, so kind of, hey, let's just give it a shot. But before we do, we're going to measure your heart rate, we're going to measure your muscle tension, and we're going to measure your blood pressure. And then you're going to have him sit through a relaxation therapy with you. So sit through yoga, sit through meditation. And once he's done that, measure those parameters again. Measure his heart rate, measure his blood pressure, measure his, I forget what the third thing I said was, but measure those things again. And what he's going to see, hopefully, if everything was done correctly, is that all of those values started to go back to normal. And so biofeedback is getting immediate physiologic feedback so that he really understands, hey, this works. And when you do that, he's more likely to continue to do relaxation therapy. Okay, so I have this flow chart here that kind of shows you the general adaptation response, and I'm going to go through this with you here. So when you have the stress response, the hypothalamus will activate the sympathetic nervous system, which releases norepinephrine from the sympathetic neurons. The sympathetic will also vasoconstrict blood vessels to the skin, the kidneys, the GI tract, which causes paleness in the skin, less blood going to the kidneys, which causes low urine production, and it'll increase peripheral resistance, right? Because you're vasoconstricting, so all of that raises your blood pressure. The sympathetic will also affect the lungs. It'll cause bronchodilation, and then it'll affect the heart. It'll increase heart rate and contractility. So it kind of just shows you the response in the body in kind of a figure, one big figure here. And then I have a flow chart that I'd like you to fill out. So this is the what is it? This is the word bank for the flow chart, and this is your flow chart, and it's basically your RAA. And I'm going to show the first one. This is decreased blood flow to the kidney, and what I'd basically like you to do is fill in the rest of the flow chart. All right, thank you. I think that's it. Well, let me see. I'll just show it so you guys have it. Okay. Okay, so quickly to go through it. So decreased blood flow to the kidneys. That means, remember, low blood flow to the kidneys was one of the stimuli for the kidneys releasing renin. Renin will convert angiotensinogen to Ang1. Ang1 will get converted into Ang2 with the help of ACE. Ang2 will do many things, including causing the release of aldosterone. One of the things, or what aldosterone does, is it turns on the sodium-potassium pump, which causes you to reabsorb sodium, and water follows. That will increase your blood volume, and it will cause you to secrete potassium, which leads to potassium loss. All right, thank you.